Dr. Earle. That's right, that's the time I get to spend with you guys and of course answer all your plastic surgery questions. So today, I thought it was time to kind of bring back the Bodytite. So I know it's been a while since we've talked about this and we have a lot of new followers lately. A lot of people here watching the Hump Day, as well as watching our videos on the YouTube channel at Pure Plastic Surgery. So I wanted to go over the Bodytite once again, kind of what it does, what are the different options, why I like it, and things of that nature, okay? So here we have the actual machine. The name of the machine is called, Bodytite. And what it does is that it uses RF energy. So RF stands for radio frequency type of energy, okay? And that's the energy that it uses in order to create an inflammatory response that will then allow the skin to retract or contract, okay? So it's essentially a skin tightening modality. It uses a very similar type of energy as the J plasma from Renuvion, which you may have heard of. So it's basically a very similar device. They're just two different competitors. And the one that we have here at Pure is the Bodytite. So the mother company of the Bodytite is called InMode. So they make this device. They do multiple other like lasers and other devices, as well as they have a muscle toning device, which looks very, very interesting and something we may look into in the future. Okay. All right. So this is the Bodytite machine, and so what I like about the machine is that there's a few things. Number one, it's very versatile in the sense that it has multiple different hand pieces that can be used, and therefore you can basically use it almost anywhere in the body. So you have like a very large hand piece to be used like in kind of the arms and thighs and like in big areas. You have to cover large areas, and there's a medium hand piece for like medium areas such as the chin and neck. And then you have like the very tiny hand pieces where you want to be going into very small areas such as like in the face or the labia. Okay, but it's really so you have all the different hand pieces. You can use it almost anywhere, and it all uses that same RF radio frequency energy. Now the difference between this and say the J plasma is that it has a lot of kind of feedback mechanisms that make it a little bit more safe overall. So that radio frequency energy, yes, it helps tighten up the skin, but it does impart heat to the tissue. So it's very temperature based, okay? And when you're using, say, the J plasma, there's no feedback. You don't really know how hot things are getting, and of course, if it's not used correctly, it can definitely lead to burns, okay? Even third-degree burns from the inside out. Now, the Bodytite has a system where I can actually set the temperature parameters, and then it can tell me when I'm getting close to that temperature, and that way I can stop and not overheat, basically, and not cause a burn. So that's a really cool thing there. If the tissues heat up too quickly, it actually even shuts off automatically. So it has all those pretty cool safety features there, which is what I liked about the machine. Okay, so like we said here, it uses that RF energy. The point of the energy is to create an inflammatory response just beneath the skin there to allow the skin to retract or contract, okay? So what are some of the areas that we use it for? We use it for the arms, for the thighs, abdomen, back, and another common area is the chin and the neck area, okay? And now, a lot of people ask, should I get the Bodytite or should I get a tummy tuck? So that's really going to depend on your specific case, because the Bodytite, is not going to be able to do, of course, what a tummy tuck can do, okay? A tummy tuck is going to be kind of the most, aggressive level of, say, tightening the abdomen, but of course, it requires a big surgery, a big scar, and everything else, okay? So everything is a balance, okay? I always kind of tell our patients that the Bodytite will do about 50% of what a skin tightening procedure would do. So about, say, 50, if it's the abdomen, say about 50% of what a tummy tuck would do. If it's the arm, say maybe about 50% of what an arm lift would do, okay? But of course, you're winning on the side of much less scarring, okay? So let me just go over, we'll talk about that, and then we just go over a little bit and show you guys some of the hand pieces there. So the first one here is the Bodytite hand piece. So it's the same name as the machine, but it's the largest hand piece that they have. And so this one's actually pretty big here. So you can actually see that hand piece there. So the functional part of it goes from about here to here. Can you guys see that okay?
Yes, we can.
So you can tell it's kind of about that long. So it's pretty long there, and it's fairly thick in that area. And so the way the Bodytite works is that the first step is you got to place that tumescent solution. So you guys know, just like similarly how we do for liposuction, so we put that solution in the tissues, we call it tumescent fluid. Okay, so you got to use that for Bodytite as well. So the first step is to place the tumescent solution, okay, and then you can perform the Bodytite. And then the order of how you do things depends a little bit on what you're going to do with the fat. So if we're going to be throwing away the fat, then a lot of times we'll do the Bodytite first and then the liposuction. If we're going to be keeping the fat for transfer, then many times we'll do the liposuction first because we need those healthy living fat cells for transfer, and do the Bodytite after. So, you know, just a little way, you know, a little difference there on how we do things. The other thing that's important is, you know, if it's a small area, say like the chin and the neck, sometimes we don't need to do lipo at all. We can just do the Bodytite alone. Or in that particular case, we call the face type. Okay, so that's the Bodytite hand piece. It's a larger hand piece. That way we can cover a larger area more quickly. And we like to use that larger hand piece for the arms, the thighs, the abdomen, and the back are the most common areas to use that larger hand piece there. Okay, not only does it cover more area, but it's more powerful. So it's the most powerful hand piece there. Okay. The next one down then is called the face type. So that's the one that we use a lot for the kind of the chin and this upper neck area. Okay, so that's the face type right there. You guys able to see that? So you see, it's a smaller area. The active area here is smaller, and then of course it's thinner and a bit smaller there. So it works well for those, you know, kind of medium-sized areas. Okay. So very common to use in the chin and the neck area. And when we talk about the neck, we're talking about from here up. Okay, we're not talking from here down. We don't do any sort of energy or lipo or anything from here down. That's where we have, you know, all our vessels, you know, large vessels and important structures and nerves and things like that. So we typically don't do that. You know, if you're having excess skin in that area, then usually what we need to do is some sort of neck lift type procedure. Okay.
So if there's a patient who's post-op BBL and has a little bit of a extra skin left over, would you recommend Bodytite?
Yeah, so that's a possibility. So we talk about that a lot, and I probably have to do another live soon because it's been a while since we talked about it. But the issue about skin laxity in a BBL, which is sometimes not well understood. So a lot of times that abdominal skin is not great quality skin because it can be for many reasons. It could be for prior pregnancies, prior weight fluctuations, smoking, sun damage, things of that nature. Sometimes we can do the liposuction for the BBL. That skin to the belly area, especially that lower belly area, doesn't retract well. It may not retract completely, or it may not retract evenly. Okay, and a lot of times that unevenness is not from uneven lipo, but it's because the skin is loose and it wasn't able to retract well. So depending on the degree of how well that skin retracts, depending on that degree depends on what our treatment is. So if it's in the mild, you know, like the question here, so it's kind of mild, then yeah, the Bodytite's a great adjunct to do afterwards to try to get that skin to tighten up. If it's, kind of just moderate and mostly focused in the lower, below the belly button, then you can perhaps a mini tummy tuck will do. And if it's then, of course, anything more severe than that, especially if it involves loose skin above and below the belly button, and if you perhaps have some abdominal wall weakness or diastasis, then of course, the full tummy tuck would be the solution there.
And can you use it at the same time as a BBL, a Bodytite?
Yes, so that's one of the great things about Bodytite. So it's not one of these procedures where we're making a large incision, so it's not like a breast lift or a tummy tuck. So we don't get, so the limit remains that high limit of 4,000 cc's, which is the max that we can do here in Florida. So when you use the you can combine Bodytite with liposuction. You can combine Bodytite with a BBL, and you don't have to, and we don't have to lower our limits. We can still do those 4,000 cc's. Okay, so that's great news on that front, right? So yeah, so that was the face tight there, and then the next kind of hand piece down is the very kind of small one, the little tiny one's called Accutite. So now it's only this big right here, very, very thin. This allows you to get into kind of smaller, tighter spots. Of course, the energy that it delivers is going to be less because these are typically areas where the skin is thin. And of course, again, you want to try to prevent any potential for burns. So, you can sometimes use this for the lower eyelids. But one of the growing areas for this Accutite is actually for the labia. So as opposed to doing a labiaplasty where you actually have to cut tissue in that vaginal area, which can then make the healing and everything very, very uncomfortable and potentially lead to scarring, which is unwanted. You can do a type of a labiaplasty with the Accutite. Okay, now that's not something that we're doing up here right now, because of course that requires some training and some skill. And but I think we're going to try to get Dr. Vidal to undergo some of that training and everything else, so that she can then offer this here at Pure, which is, I think, a great solution to any excess skin in the vaginal and the labia.
Thank you. So you just said the Accutite is more for the face. And if you get Accutite in your chin or your neck, what's the recovery for that?
Yeah, so for the chin neck, we can use the face tight, which is that medium one, but the recovery is actually pretty straightforward if that's all we're doing. Okay, so if the issue is mostly some loose skin and not a lot of lipo can be done, sometimes it can be done just the face tight alone without any liposuction. What you do need to know is that you have to wear a garment, so it's kind of like a chin garment. And what I always tell my patients is you got to try to wear this thing as much as you can in the first 4 to 6 weeks or so. So you definitely want to be wearing it at night while you're sleeping. You can wear it at the house when we're not seeing people. And I understand, of course, sometimes you got to go to work, you got to do your Zoom call, right? You got to meet some people face to face, and you don't want to have it on, and that's okay. But try to wear it as much as you can in those first 4 to 6 weeks, okay? Other than that, though, the downtime is really pretty much almost zero. There's not a lot of swelling, not a lot of bruising. Especially if you're working from home, you could probably start working from home the very next day. If you drive around, move around, maybe you want to take a couple more days off. But really, it's very minimal downtime.
It seems like many surgeons use J-plasma. Can you explain why you have Bodytite versus?
Yeah, so it's a lot of what I talked about at the very beginning. So I like it because of the versatility. So all the different hand pieces that we like. So J-plasma essentially comes with one fairly large hand piece, and that's mostly used for the big areas like abdomen. Actually, where I've seen it the most is the abdomen. I don't see it really being used much more anywhere else. Okay, so that's very kind of limiting. So I wanted a machine that does something very, very similar, but we can use it in different parts of the body there. And it has one more feature which I haven't even talked about yet, which we're going to get to here in a minute. And the other thing is what I talked about in terms of the safety feature. So the J-plasma doesn't tell you how hot the tissue is getting, whether you're getting close to burning the patient or not, or anything of that nature. So the Bodytite does. It has feedback mechanisms. It lets me know the temperature of the skin. It lets me know both an internal temperature, so the temperature kind of beneath the skin there, and an external temperature, so the temperature on the top of the skin. And it sounds an alarm if we're getting too hot, and we know to stop, move on to a different area, and try to minimize the risk of burns. Okay, so that's another aspect that I like about it. Because I was getting into I'll show you here with a bigger one, but that first step is the tumescent solution. Okay, and then this probe here, which the one down the bottom there, that one actually goes underneath the skin, almost like where a lipo cannula would go. Okay, so one goes underneath the skin, this one goes on top of the skin. Okay, so you have, so basically it's kind of, so the skin's in between. You have the metal probe at the bottom, the other one at the top. So you're heating the skin both internally and externally. Okay, and so when you do that, you create that inflammatory reaction that you want to try to get the skin to try to retract or contract back. Okay. So those are all the reasons why I like this, and there's one more which we can talk about right now. Okay. So the same machine, the Bodytite machine, also carries with it something called Morpheus 8. And so what the Morpheus is, I don't know if some of you may have heard of microneedling. Well, this is basically microneedling on steroids. Okay, so it's 24. So this one that I have here is a 24 pin attachment, and it goes connected to this kind of cool gun taser looking thing. Okay, and so it has 24 needles, and the needles, once they go in, they release some of that same RF radio frequency type energy. Okay, so you got the 24 pins, they go in the skin. It can be anywhere from 1 millimeter to 4 millimeters, so you can change the depth of how deep you want it to go, and then it releases that energy for skin tightening. And so this works. I like this more actually than the Accutite or anything else for the face itself. Though the downside though is it requires 3 treatments. Okay, so it requires 3 treatments 1 month apart. The upside is that you don't need any sort of anesthesia, not even like lidocaine that we inject. We just give you a lidocaine anesthetic type of cream. You put that on your face or wherever we're going to be using this. You leave it on there for about 30 minutes or so it really gets in and really starts to work. And then you can go straight to this, completely awake. This is totally one of those kind of extended lunchtime procedures. You take out an hour for lunch, you can get it done, go back to work. 0 downtime basically, and you get those 3 treatments, and it really helps smooth the wrinkles on the face, and allow the skin to retract, and basically try to maintain a more youthful look to the skin in the face area. And it can be used anywhere along the face, so along the cheeks, the jawline, the lower eyelids, the forehead, pretty much the entire face area can be covered.
Is that one treatment, or do you need multiple?
Yeah, so like I said, you're going to be needing at least 3 treatments for best results, and they should be done 1 month apart. Okay, so you get treatment number 1, one month later you get treatment number 2, 1 month later you get treatment number 3.
Thank you.
Okay.
Question: I've heard some doctors wouldn't perform J-plasma on clients who have had lipo before. Is that the same for Bodytite?
I'm not. Yeah, so I don't know why exactly they would say that unless the patient has something like a laser lipo or something before. So it's not necessarily the same for the Bodytite, and it's not necessarily the same, I think, from doctor to doctor. So I think it depends a lot on the patient and some specifics. So let me be more clear. So for example, if the patient has had lipo before and they have a lot of fibrosis, then yeah, it's probably not a good idea to do neither J-plasma nor the Bodytite, because it's really hard to try to get that probe through there because of all the scar tissue and the fibrosis. Another example is if a patient's had smart lipo or laser lipo in the past. Okay, so that causes again a lot of what we call adhesions and scarring and fibrosis, making trying to put the cannula through there very challenging, very difficult, and that's probably not a candidate then for either one of these procedures. But if you had lipo before and it's been at least 9 months, but preferably over a year since then, and then things are all pretty things have softened up, you're not having a lot of scar tissue, you're not having a lot of fibrosis, then it's certainly okay to be using the Bodytite after that.
Little off topic, but have you done any lipo 360 and breast augmentation on someone with rheumatoid arthritis on remission?
Okay, so I'll take that in 2 parts. Number one, I don't normally do the breast dog and the Lipo 360 at the same time, okay? For most patients, unless they're a lower BMI patient. Why is that? Because in the state of Florida, once we do that breast augmentation, then we get limited to 1,000 cc's of fat removal via liposuction, okay? And this is for all this is given to us or mandated to us by the Florida Department of Health, okay? So this should, be affecting all Florida surgeons. So I know some are not doing it, but really it's for all surgeons, and those are the rules down here, okay? So unless you're a lower BMI patient, it doesn't really make a lot of sense because you're not going to get enough liposuction to make as much of a difference as you would like. But in the lower BMI patient, yeah, we've done it. We've combined the breast augmentation with the liposuction because they don't have that much fat that needs to be removed. Now, rheumatoid arthritis is tricky because a lot of times patients that have rheumatoid arthritis are on immunosuppressive drugs. And if you're on immunosuppressive drugs, then I typically don't recommend, elective surgery, as that can lead to potential complications post-op, especially infection, which is something that we worry about.
Is it true that years after a breast lift, your breasts may begin to lower again?
Yeah, of course. So at the end of the day, gravity always wins. The only thing that a plastic surgeon can do is turn back the clock. But once you turn back the clock, it's going to start ticking again. So we can never beat gravity, we can never beat age, and by age I mean that the quality of the skin becomes worse and worse as you age, okay? Because there's less what we call elasticity. So these fibers that you have in your skin, it's called elastin, you get less and less of those as you age. So you can't beat aging and you can't beat gravity. So as you become older, then your breasts will probably will start to to drop or droop once again.
If I still have scar tissue and bumps after lipo at 10 weeks, does that mean it's going to be permanent?
No, so at 10 weeks you're still in time. So at 10 weeks you're still in time to try to improve those areas. And so what can you do? So of course, you got to continue with your adequate compression. At 10 weeks, so you should be doing that only 12 hours a day. So you shouldn't be in your faja anymore 24 hours a day. Okay, so after 6 weeks, you can scale down to 12 hours a day, and you should definitely be doing that to give the skin a chance to breathe. And then your massage, okay, it becomes incredibly important. Of course, you want to do your professional massages with a very, very experienced post-lipo massage therapist, okay? And you can also start doing some self-massage. Typically, the best thing to do is to make sure you stay on top of it.
Thank you. Question: why are you refusing patients with a history of DVT after a fractured ankle?
So we refuse pretty much all patients with a history of DVT for whatever reason, and that's because their risk of another DVT is significantly higher than the general population. Okay, so just merely the fact that you have a history of DVT makes your current risk of a DVT higher, and therefore it's just the risk is too high for us in this kind of office-based surgery setting. So yeah, we typically don't take patients that have a history of a DVT or a PE for any reason.
How well does Bodytite work with thighs that already you have loose skin?
Right. So Bodytite, so this is what I want patients to understand and you guys to understand. I try to explain this as much as I can. So is the Bodytite gonna do the same thing that a thigh lift will do? Or is the Bodytite going to do the same thing that an arm lift or a tummy tuck will do? Okay, and the answer is no. The answer is no, it will not. Okay, it'll probably get you maybe 50% there. Okay, but you're winning on the side that you're not going through this big surgery with a big scar. Hold the patient's hand for many, many weeks as they go through that tough recovery because it often has wound breakdown. So areas of the wound that open up and then require dressing changes. It often has seromas that require multiple drainages. Sometimes it has areas that become infected that either have to be opened up or drained as well. So it's a tough area to recover because we're always moving around, we're always walking, so we're always putting stress on the area that's just been operated on. And on top of that, the thigh lift, especially if you do a medial thigh lift, it's all in that groin area. Even if you do a vertical thigh lift, a lot of that that upper scar is at or near the groin area, and that's just an area that's very hard, in terms to maintain like dry and clean at all times. So for all those reasons, the complication rate is high, and the recovery is tough, and so I think unless you're like a super massive weight loss patient, I think the Bodytite is a very nice compromise. Okay?
So if I've had liposuction in the past and then come to you, can you use the same incisions from the old lipo?
It depends. It depends where they've done. So, each surgeon has a very particular way of where they like to place their incisions and how they like to do their lipo. So if it coincides with kind of the way that I typically do things, then yes, we can try to use those. And certainly for any patient that I've done before and is coming back, I'll use my old incisions. But if you're coming from another surgeon and they just have a different approach or different method, and their incisions are completely in a place where I'm not like really comfortable, then I'll typically just make my own incisions.
How can you get rid of scar tissue after 7 months?
So after 7 months, it starts to become more tricky because you're starting to get close to that year mark. But you definitely need to be seeing your well-experienced massage therapist, because typically what can be done later is something called wood therapy. That's one of the ones that's reserved for a little bit down the road. And I would definitely ask him about that. Sometimes if it's a very specific spot, a little steroid injection can help. And so that's another possibility there.
Thank you. Next question would be, do you recommend Bodytite on your stomach with Lipo 360? I have no kids, BMI is 29.
Yeah, so I think that's definitely a possibility. Of course, I would have to look at your photos and everything else to make sure. But yeah, we can definitely combine the Bodytite with the liposuction. And if your skin laxity is kind of in that mild to moderate range, then I think it's a good option. And now you have excess, like a lot of excess skin, then the Bodytite's probably not going to be worth it, because you're only going to get some degree of retraction. You're still going to want to do that tummy tuck later after you've decided you're not going to have any more children.
You said some areas might need lipo instead of Bodytite if it's too loose, but what if you did two?
A possibility, and it does help with each round. Again, I would probably, if you're going to do that, I would probably separate them out by at least a year. Okay, so the Bodytite plus minus lipo, you want to separate that out for about a year. But yeah, you can certainly go back and use the Bodytite to the same area again and get some more retraction at that time. Now, again, this is for the qualified patient. I'm not going to recommend this for someone who, say, lost 150 pounds and has like really long, like overhanging, abdominal skin or pannus. There aren't enough rounds of Bodytite that's going to be able to help a patient like that.
After a BBL, when can I start sleeping on my side? And then when can I start sleeping on my back?
Okay, so typically at 6 weeks, okay? So at 6 weeks, you can sleep both on your side and your back after your BBL. Before then, you should try to sleep, face down. If, we do have some patients that just can't sleep that way, and like for me, I know me personally, I wouldn't be able to sleep face down. So for those particular patients, then you have to find an alternative, which is usually some sort of like cutout, whether it's a cutout in the mattress, or you get an inflatable with a cutout, where you can sleep face up, but then the area for the buttock and hips is cut out, and therefore you're minimizing pressure to that area. And that's really the whole point. The whole point is trying to minimize pressure to the buttock and hips for the first 6 weeks.
How long do you go back to feeling normal after a BBL?
So, define normal,
yes,
right? It's going to be several months. Of course, it varies from patient to patient, but you cannot think of it as something that's going to happen 3 months or more, and for most patients, I would say it's more. So easily anywhere between 6 months to a year.
For my second round, Lipo 360, will you still try to max out at 4 liters, or only as much fat as you can get, even if it's only 2 to 3 liters?
Well, so yeah, it depends on how much fat you have. So if you don't have 4 liters, then you just don't have it. But if you do have the 4 liters, then we'll get you to 4 liters again. Now, Yeah, I mean, a lot of patients, so there is a kind of a degree of diminishing marginal returns, meaning you could probably get 4 liters pretty easily in the first round. It's going to be tougher to do it in the second round. Why is that? Well, of course, A, you already removed 4 liters, but B, even if you have some of that left, it's tougher to remove that fat because now there's some more fibrosis and scar tissue and things of that nature. So it is, the law of diminishing marginal return. So for most patients, easily get 4 liters the first round. Depending on where they started, you may or may not get 4 liters the second round, and of course even less for a third round.
All right, I know you have time for a few more questions, so
all right,
let's knock them out. How many massages do you recommend after a BBL?
Yes, so I used to say, and I still say, that the absolute minimum is 10, but that's kind of where I stopped that conversation. But now I've been noticing that really, I mean, some of our patients have had like truly just fantastic results. They've been getting at least 20 massages, okay? And our very own, Yanisi here, who has a great result, she ended up getting about 28 massages, okay? So while it's definitely true that the absolute minimum is 10, I recommend about 20 massages to try to really optimize your results.
So for somebody who just wants that inner thigh gap, can we use Bodytite for that?
Yeah, so Bodytite would be an option for that. Like I said, not everyone's going to qualify. For someone who we could potentially get a thigh gap, typically, their skin can be too loose, all right? So it's not going to be like a massive weight loss patient. It's just going to be someone who has a little bit of extra fat, a little bit of skin laxity to the area, and the Bodytite's really going to get them the extra mile, which a lot of times is very difficult, sometimes nearly impossible to do with diet and exercise alone.
Thank you. All right, last question. How long after a BBL can we do non-invasive RF body contouring?
So you're talking about the external, I believe you're talking about, right?
I believe.
Yeah. So for external RF body contouring, you want to wait about 4 weeks after your liposuction BBL. Okay. So that's a big distinction there. So you can use that radio frequency energy, RF energy externally. Okay, it's definitely not going to be as aggressive and of course less invasive than the Bodytite. So even though you're hearing that the Bodytite also uses RF energy, this is going to give you a significantly more skin retraction than those external devices.
Thank you very much. I know you have to go soon, so let's wrap this up right now.
All right, excellent. Okay, everybody, well, I hope that clears some things up. I know it's been a while since we had talked about it. We're really still excited about the Bodytite, and we're also excited about the Morpheus, which can be done, like I said, it's just simply with that cream on your face. No need for needles, no need for IVs or anesthesia. So that's really great there. Okay, but we'll look forward to seeing everybody next week, Wednesday. We may have a surprise for you. We're working, so stay tuned. We'll see you guys next Wednesday on Hump Day with Dr. Earle.